Hello, thanks for attending your shift. You are all healthcare champions. I just want to take a few minutes to go through some essential information to help keep us all safe during this pandemic. Firstly, are you maintaining your social distancing during this briefing? Make sure that you're at least 1.5 metres from your co-workers. Secondly, I want to confirm that no one has a fever, respiratory tract, or any gastrointestinal symptoms. Please let your supervisor know immediately if you develop any. Thirdly, take time to familiarise yourself with your local guidelines. This will be time well spent for you and your co-workers' safety. Hand hygiene is one of our most important protections against Covid19 and other infectious diseases. Here are some important reminders. The 5 moments can be hard to remember, so just focus on before and after every patient encounter and their surrounds. Tell your patients, I'm now using hand sanitizer to protect you from infection. Are you naked below the elbows? Check all staff have removed their jewellery and watches. Also, no lanyards. And remember to clean your staff ID as directed. No clinical specimen should leave the bedside without being bagged and hand hygiene being performed. And always follow your current local guidelines for Covid-19 specimens. Clean your stethoscope and any other medical equipment before and after every patient encounter. Only take essential items with you to the patient. Don't answer your phone during any clinical encounter. Mobiles and phones can spread the virus. Treat them as you would any other medical equipment. Remember, social distancing is essential to reduce the virus spread. So as you know, no handshakes, they'll understand. Minimise any non-essential relatives. Be aware of the latest restrictions. Apply the sneeze and cough etiquette at all times. Remind everybody about social distancing. This is important as we can easily forget. Keep an eye out and politely remind people. Remember, no food or drink in clinical areas. Keep the surfaces free of clutter so that cleaners can easily and effectively wipe down surfaces. Now, I want to talk about PPE. PPE is essential to keep everyone safe. For the putting on and taking off of PPE, please review your procedures. And if you've not already done so, complete the training and assessment. I cannot emphasise PPE enough. The taking off of PPE is the highest risk for the healthcare worker, and we want to keep you safe. In a pandemic, there is no medical emergency that trumps PPE. Do not rush to help an unwell person. Stop, think PPE first. So I say again, take your time for your safety, your co-workers and the community. It's all about keeping us safe. Finally, how are you going? If you feel like you need a few minutes to chat about any concerns, please talk to your supervisor. Thank you and have a good shift. You are all healthcare champions.